Is everybody in? Okay, first question is, vaccination is available against which of the following hepatitis types? And the options are hepatitis A, B, C, A and B. The correct answer was hepatitis A and B. We have vaccinations for hepatitis A and B and not for C. For which case it would be best to withhold the vaccine until a later date, that i.e. delay the vaccine. So in which cases we have to delay the vaccine. Okay. MMR vaccine for a 6-year-old boy with HIV CD4 count of 650. MMR for a 6-year-old girl receiving etanercept. Etanercept is a biological product. Or C, flu vaccine for a 1-year-old with otitis media. Or last one, Tdap for a pregnant woman. If you have not figured out, MMR is a live vaccine. In exam, you have to figure out yourself. I will not be there to tell you. No. Remember, MMR is a live vaccine. So, guys, MMR is a live vaccine. So you need to remember in situations in which live vaccines should be avoided. The first one was MMR should be avoided in HIV patients where CD4 count is less than 200. But here the patient has CD4 count more than 200. So we can give MMR vaccine. Second option was correct because this is a patient who is receiving the biological product. Etanercept is a biological product, so that's why option B was correct. Which of the following vaccines usually is not given until after the child's first birthday? Now this is where you need to remember the MOH immunization schedule. Which of the following vaccines usually is not given until after the child is first birthday? Flu vaccine, MMR vaccine, Tdap or Hep vaccine, which is Haemophilus influenza. MMR vaccine, okay, if you look at the immunization schedule, MMR vaccine is the one which we start at 1 year. It says the question was about child's first birthday, which means at 12 months. The vaccine which you start at 12 months. Okay, guys, it was the vaccine which you start at 12 months was MMR vaccine. Okay. Which of the following is contraindications to inactivated flu vaccine? Which of the following is a contraindications to inactivated flu vaccine? Pregnancy, breastfeeding, anaphylactic reaction, or egg allergy. Come on, remember, everybody. Anaphylactic reaction is the absolute contraindication to any vaccine. Okay. Okay, next question. Question 5. Which of the following vaccine is strongly recommended for people going for Hajj? It's an easy one. Guys, not Haemophilus influenza vaccine. Again, as I said, do not get confused with the flu vaccine. This is not the flu vaccine. This is Hep vaccine, which is against bacteria. Haemophilus influenza B. Okay, next question. Okay, now you need to pay attention here, everybody. A 28-year-old female comes to the pharmacy during flu season asking for advice on whether she needs to receive the flu vaccine. She has recovered recently from a flu virus. Okay, so she has recently had a flu virus, and now she's asking, she's not treated, and she's asking, can she now receive the flu vaccine? Okay, what's your recommendation? A, she should not receive the vaccine because she had the flu and has antibodies now. B, she should not receive the vaccine because she's not a high risk. C, she should only receive the vaccine if she wants to boost her titers for antibodies. Or D, she should receive the vaccine. Okay, last one is correct because she's just being treated now, so there is no reason she should not be given. No, she should. The C is about she should only receive if she wants more antibodies. Only, but she should receive the flu. Everybody should receive the flu vaccine now. Question 7. At which of the following age it is recommended to switch from Tdap to Tdap? Okay. 2 years, 5 years, 7 years, or 10 years? Okay, it's 7 years. Okay, I mentioned that it's 7 years. Question 8. The immunity of... Okay, I did not mention this one, but let's see if you can guess. The immunity of which of the following vaccines generally wears off after 10 years? What that means is, when you give the vaccine, you get the immunity for 10 years only, but after 10 years, you need another dose of it, this vaccine. MMR, varicella vaccine, pneumococcal vaccine, or TD? Come on over. It's TD, tetanus diphtheria. It needs to be repeated after every 10 years. Okay. Okay, question 9. If a second dose of vaccine was given too soon, before the minimum interval, like 4 weeks, the correct action would be you restart the entire series, do not count this incorrect dose and repeat it. Do not worry about it and continue with the next dose as scheduled, or double the next dose. So this is where you have multiple doses of one vaccine. Okay. The answer is B. So if the dose was given before 4 weeks period, you do not count that dose. Okay. Question 10. A 10-year-old received, okay, this is an important one to pay attention. And an 18-year-old received MMR vaccine at her first clinic visit and the varicella vaccine 2 weeks later. Her mother wants to know if this method was acceptable. Which of the following is the correct response? A. They were given correctly and her daughter needs they were given correctly and her daughter is now protected. B. They were given too close together. Daughter should have been given vaccine repeated after 1 month. Or C. They were given too close together. Or D. Okay, first of all, you have to figure out these two vaccines are live vaccines or not. Both of these are live vaccines? Yes, both MMR and varicella are live vaccines. So that means they should be given on the same day or 28 days later. So the patient was given MMR vaccine, that was fine. Varicella vaccine was given after 2 weeks. So that means that's varicella 1. This varicella 1, this is the incorrect one, varicella. So that needs to be repeated after 2. So varicella vaccine was given incorrectly, so the varicella vaccine needs to be repeated. So you will give the varicella vaccine 1 month after the first day of the varicella vaccine. Okay. So varicella vaccine was given incorrectly. So this needs to be repeated after 28 days again. Okay, that's what it means. Okay. Which of the following vaccines can be administered either intramuscularly or subcutaneously? Well done, everybody. I'm impressed. It remains the same. Question 12. Which of the following vaccine is recommended at birth in Saudi Arabia? Okay, that was an easy one actually. Hepatitis B vaccine. Remember the two vaccines recommended at birth in Saudi Arabia, hepatitis B and BCG. Which of the following is the most common adverse reaction to an inactivated vaccine? Sorry, I pressed it before time. It's injection site reaction. That's nice. Question 14. How long does it take before a flu vaccine provides you with maximum protection against the flu virus? Immediately, 5 days, 2 weeks, or 30 days? Okay, it's 2 weeks. Okay. Question 15. Healthy children over what age should not receive a Hib vaccine? 2 years, 5 years, 7 years, or 6 years? I think I did not mention this, but it was 5 years, everybody. Hib vaccine, maximum it can be given up to 5 years. Okay. Question 17. Okay, 3 more questions of which of the following patient is at the highest risk of developing complications from infection with flu virus? Okay, this is where you need to read it. A 70-year-old female with COPD, hypertension, dyslipidemia, or a 74-year-old lives in cold nursing facility, or C, 67-year-old healthy female, or 72-year-old male recently diagnosed with hypertension. Which of them has the highest risk of developing complications because of the flu virus infection? Come on, everybody. Guys, A is the patient who has more diseases. So that is quite obvious. The patient is old and the patient has more diseases. So that's why it's more likely to develop complications. Okay. A 24-year-old patient is receiving oseltamivir 75 milligram orally once daily. Can he receive influenza vaccine now? Okay, I'll come back to it later. Okay, I accidentally pressed the next button and I cannot go back. Okay, last question. Children under the age of 9 require 2 doses of flu vaccine in the same season if children under the age of 9 years. Children under the age of 9 years, I think I mentioned 7, it's 9 actually. Children under the age of 9 years require 2 doses of flu vaccine in the same season if it's their first dose, or B, they have not received influenza vaccine for the past 3 years, or C, they have a weakened immune system, or D, they had 2 flu vaccines in the previous year. That was the last question. Okay. They receive 2 doses in the same season if this is their first ever dose in life. Okay. Okay, well done, Mutib. A 24-year-old patient is receiving oseltamivir. Can he receive flu vaccine now? No, because he's currently receiving antiviral therapy. Yes, because he's only receiving the prophylaxis dose. Yes, he can receive inactivated vaccine. Yes, he can receive the live flu vaccine. I will display the answer because we have finished the computation anyway, so I will just display the answer. The answer was yes, he can receive while having the antiviral therapy, but the inactivated one. Okay, everybody, any questions about vaccination?